Good morning to all the esteemed delegates and chairpersons present here. I'm Dr. Paj Mehta from Shankar Netralaya, and I'll be speaking on histopathology, immunohistochemistry, and molecular biology in enucleated eyes in ocular inflammation. The aim of this study was to report the histopathology, immunohistochemistry, and molecular biology in enucleated eyes secondary to ocular inflammation. This was a study conducted over a period of 10 years where a retrospective chart analysis was done for 13 enucleated globes secondary to intractable ocular inflammation. Sympathetic ophthalmitis accounted for 6 eyes. Tuberculosis was the etiology in 2 cases of Eales disease, 2 cases of panuveitis, and a case of sclerouveitis. We also studied a case of acute retinal necrosis and VKH disease each. Acute retinal necrosis it shows a histopathology of enucleated globe in a 40-year-old immunocompetent man, showing chronic inflammation of the peripheral retina with perivascular lymphocytic infiltration. The right side shows a microphotograph showing retinal vascular occlusion. Viral inclusion bodies were seen in the necrotic retina. Semi-nested polymerase chain reaction for detection of varicella virus, showing the targeting ORF63 region. The specimen for paraffin blocks were subjected to the semi-nested PCR, which was also positive for the ORF63 region. Immunohistochemistry was strongly positive for CD3 T cells. Sympathetic ophthalmitis is characterized by diffuse granulomatous uveal involvement. There is a relative lack of retinal and choriocapillaris inflammation. Dihlen-Fuchs nodules may be seen, and the granulomatous process may even extend to the scleral canals and the optic disc. Histopathology slides showing ciliary body inflammation, diffuse inflammation in the choroid. Diffuse inflammation of the choroid with choriocapillaris uninvolved, and special finding of phacoanaphylaxis was noted in one of the cases. In the isolated case of Koyanagi-Harada disease, we found diffuse choroidal inflammation with lymphocytes and plasma cells. There is photoreceptor degeneration with pockets of exudation seen in the outer retinal layers. Choroidal neovascular membrane was seen with outpouring of the RBCs. Immunohistochemistry showed strong CD3 and CD20 positivity. In one of the cases of Eales disease, neovascularization was seen into the vitreous cavity with lymphocytes in the inner vascular and perivascular areas. Generally, granulomatous response secondary to mycobacterial TB shows type 4 hypersensitivity with CD4 T cells, but there was a characteristic CD8 cytotoxic T cell positivity in case, possibly because of ocular immune privilege. Nested PCR was positive for MPB64 and IS6110 genome of Mycobacterium tuberculae. This is a gross specimen showing a thickened choroid in a case of tubercular sclerouveitis in a patient with rheumatoid arthritis. In another patient, multiple granulomas were seen in sclera, and acid-fast bacilli were isolated within the retinal pigment epithelium. Agarose gel electrophoretograph was positive for both the mycobacterial tuberculosis genomes. To conclude, histopathology, immunohistochemistry, and molecular analysis of enucleated globes can give an insight to etiopathogenesis of intraocular inflammation. Thank you.
Yes, compared to immunohistochemistry and histopathology,
Yes, sir.
what is the difference?
Sir, histopathology is basically the tissue that you take and with serial staining of different stains that we use, we can pick up particular stains of tissues. Immunohistochemistry basically involves usage of markers, antibodies, which specifically bind to the antigens, and those can be detected with respect to serial testing, specific tissue targeted antibodies.
Clinically, how you judge that this specimen you want to do immunohistochemistry or you want to do only histopathology?
Sir, it was done for all of the enucleated eyes which are having ocular inflammation, intractable ocular inflammation which had no perception of light and no visual prognosis. Many patients wanted a cosmetic correction also. So for that, enucleation was done with ball implant.
Is there a protocol to do in all cases of inflammation? So we have enucleated the eye.
Sir, the whole purpose was to basically know the etiopathogenesis. So whatever causative factors we could find out from those eyes, those were studied, and a particular pathology or etiopathogenesis responsible, we tried to find that out.